Hey guys, today we will be completing a full cardiopulmonary assessment. The first part of the exam is the visual exam, where the PT will inspect the environment for equipment in use and supplemental oxygen settings. The next part is the vascular exam. The PT begins by checking for jugular venous distension. Next, the PT looks at temperature and color in bilateral lower extremities. Moving on, the PT looks at pitting edema in bilateral lower extremities. Now, the PT is examining breathing pattern and palpating chest wall configuration for any abnormalities. Now, the PT will look at vitals. PT is taking patients' radial pulse to get a heart rate, while also looking at the rise and fall of the chest for respiratory rate. Normal heart rate for adults is 60 to 100 beats per minute, and normal respiratory rate for adults is 12 to 20 breaths per minute. Next, blood pressure is taken with the patient's feet flat on the floor after she has been seated for 5 minutes. The PT is now scanning all pulses to check for abnormal vascularization. The next part of the exam is heart auscultation. The PT will begin by exposing the area. She then will find the second intercostal space to the right of the sternum to listen to the aortic valve. Moving to the left of the sternum, we are now listening to the pulmonary valve. Moving down to the fifth intercostal space beside the sternum, we listen to the tricuspid valve, and the mid-clavicular line, the bicuspid valve. PT then proceeds to listen again using the bell of the stethoscope, which uses light pressure to listen to low sounds. Next is lung auscultation. PT exposes the area and begins at the apex of the lung, listening with the diaphragm side of the stethoscope. Posteriorly, the PT listens to upper and lower lobes of the lung, comparing bilaterally. For all lung auscultations, the PT will repeat this process using the bell side of the stethoscope. Anteriorly, the PT listens to the upper, middle, and lower parts of the lung, comparing bilaterally. Lastly, PT will auscultate laterally, listening to the lungs in the upper and lower lobes, comparing bilaterally. Next, the PT will perform percussion on the patient. She is listening for resonance as a normal lung sound versus an abnormal dull or thud-like sound, which would be interpreted as consolidation in the lungs. PT will compare bilaterally. Lastly, palpation is performed on our patient to look at normal breathing mechanics. This will end our examination.
This is how we do it.